Hello and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Doctor Rachel Berkowitz. She has an extensive background in public health and community engagement, with a career including various roles and research initiatives. She has dedicated herself to improving health equity, addressing health disparities, and conducting research in the field of public health. Her expertise in public health makes her a valuable resource for understanding the challenges and opportunities within the field. Welcome to this interview, Dr. Rachel Berkowitz.
Thank you for having me.
What motivated you to pursue a Doctor of Public Health degree at the University of California, Berkeley?
It's a great question. So after I completed my Master's of Public Health, actually at Emory University, so right here in Atlanta, I really hoped that I knew I wanted to do applied research. I knew I wanted to continue to do community engaged work. And I didn't really think I needed a doctorate in order to do that. You can do amazing work with a Master's of Public Health, really important work. And so I really started my journey thinking that after my master's, I would work maybe for a public health department, maybe, having the opportunity to continue to teach, because I taught, during my master's program and I really loved it, but I didn't think I needed a doctorate and, all of that. And then as I moved to California after my master's in public health and had the opportunity to work in a number of different community-based, place-based, sort of community-engaged public health initiatives. And I found myself, wanting to learn more, wanting to strengthen my skills, particularly my skills as a public health leader and my skills in quantitative methods, because my background was all qualitative methods and I love qualitative work, but I wanted to be able to do both. And so for those two reasons, I wanted a DrPH because that's an applied doctoral degree. A lot of us go on to do applied work and applied research all across the field. And so that was the degree I wanted. And then while I was there, I got to learn more about social epidemiologic methods while also learning about being a public health leader.
Wonderful. Now, could you tell us about your role as an assistant professor at San Jose State University?
Absolutely. So this is my third year as an assistant professor at SJSU. I am in the Department of Public Health and Recreation. And in that role, I have the privilege of teaching, of doing research, and also being of service both to my department and my university, but also kind of service to the field of public health. And so part of the work I do with the Community-Based Public Health Caucus at APHA is part of my service to the field. As a teacher, I get to teach evaluation and community organizing with our Masters of Public Health students. And I also have had the chance to teach other classes with our undergraduate public health students in, the human life course and introduction to epidemiology and public health. And then in terms of research, because San Jose State is so deeply grounded in Santa Clara County and San Jose, so many of our students are local, we're really immersed in our community. I have gotten to do new research that is community-based and grounded in supporting health equity endeavors in my own home. I live in San Jose too, so I get to live and work and serve my community through my public health teaching and research and service. So, yeah.
Sounds like great work. Now, tell us a bit more about the caucus. What are the achievements and challenges the caucus is experiencing?
Absolutely. So the Community-Based Public Health Caucus has been around for over a decade, and our mission is to uplift and center the work of community and academic partnerships, of community-driven work and research, and to really provide a platform for all the fantastic scholars and activists and programmatic workers who are doing community-driven and community-based work to show up here at APHA and to connect with each other more generally to support their work. And so I would say I've been one of our program planners who's part of helping to develop what we do at APHA. I've been a program planner for the past few years, and to me, the biggest success is the amazing folk who share their research and their work with us, that we get to hold space for them to present. Every one of our sessions, I'm always just blown away, and I always learn something new no matter how long I've been in the field. In terms of challenges, I think, we are a very dedicated, all the leadership in the caucus is incredibly dedicated and are also incredibly hardworking individuals outside of the work they volunteer for the caucus. And so I think a challenge, like any group of passionate and committed folk, is how do we make sure that we're okay, we're supporting ourselves, and then how do we grow? And I think we're actually in a really exciting time where we are pushing for an additional layer of growth with our fantastic leadership going forward. So
that sounds fantastic.
Yeah.
Now, how do you see your diverse educational background, anthropology, global health, and public health? How are they contributing to your current work and projects?
Yeah, I would say my grounding in anthropology, which is what I studied as an undergrad, and with a focus on kind of medical anthropology and cultural anthropology, it gave me a home in qualitative research, because I learned ethnographic research methods as part of that, but also just some tools and a lens for centering learning about others and the cultures and priorities and perspectives of others as the first step in any work that I do. That you start by listening, by learning, and by looking for opportunities for partnership. And I think that led me to global health, and that led me to what I focused on during my master's in global health, which was community health and development. I became very passionate about community-driven transformation. How can we strengthen the places where we live, work, grow, and play, and worship? And then how do we understand the ways that policies and systems and structures affect the nature of those places? So how do we then intervene more upstream, right? And so the other thing that doing a master's in global health gave me an appreciation for is global health isn't about work within one country or another. Global health is really all public health, because we are part of a deeply interconnected global community. What I do affects what happens in other places, and what happens in other places affects me and my health and well-being. And so I still see myself as a global health, public health practitioner, even though I don't currently do any work outside of the United States. And then the doctorate of public health really gave me a chance to hone in on some skills I wanted, certainly meet tremendous people, and strengthen my confidence and perspective as a future leader in public health.
Wonderful.
Yeah.
Now, global health and local health, let's say U.S., what are some of the key differences or similarities when we talk about U.S. health and global health?
So to me, global health encompasses the health of populations around the world. And because of the interconnectedness of our societies, including the influence that US politics and practices have on places around the world, and the influence that, systems and structures outside of the United States affect us, to say nothing of issues like climate change, which very much has global implications and deeply local implications. I don't see many differences except for scale. I would say that when you're doing locally based work, you are being intentional about the scale and scope of your engagement, but you still need to be mindful of your privilege and power and status when you're working in a local community, just as you need to be if you're leading a global health study with 5 different countries who are part of it. You still need to be aware of differences in priorities and perspectives. You still need to work to forge equitable partnerships. It's just at a local level, you're kind of intentionally setting a smaller scope. And at a global level, you're intentionally setting a broader one. But if you go to another, I've had the privilege of working in communities and with communities outside of the United States. And my work in with those experts, those community researchers in that local space, the approach is the same as when I work in a local community in rural Minnesota, which I also had the privilege of doing, right? The circumstances are different, the people are different, the nature, what you learn and where you go is different, but starting from a place of cultural humility, starting from a place of centering partnership and equity, that doesn't change. So
it sounds like the principles are the same for both. Now we are at APHA 2023. Today's the second day. So what are your thoughts so far about APHA, and is there something in particular that you like to take away from this experience?
So far, APHA, because I get to serve as a program planner, I'm doing a lot of running around and supporting all of our fantastic presenters and moderators. And so it's a real privilege just to learn from so many different folk, doing diverse, community-driven and community-engaged research and practice. I think, and like I said, I always take away something new and unexpected from that. I think I feel really privileged that we get to hold space for them to share. And so the satisfaction of like seeing these folk who who applied to present with us, and then they were accepted, and now they've worked on their presentations and they're here, getting to see that, especially when folk co-present with their community and academic partners present together. It's a feeling of satisfaction. I'm grateful I get to be a part of it. So yeah, I hope to just take away that sense of new lessons from our presenters, and just a sense of gratitude and pride that they did the amazing job that they are doing.
Yeah, it's been wonderful so far. So what is Dr. Rachel Berkowitz looking forward in the future?
So I'm looking forward to, in my current role at SJSU, there's so many opportunities to grow for me as a professional. So if I'm thinking professionally, what I'm looking forward to in the future, continuing to strengthen the way I teach and get to engage with our masters and our undergrad students, hopefully bringing more students into my research. That's something I'm really excited about, and expanding my research agenda to include building on more place-based, community-driven, health equity-centered work. I would love to be doing more and more of that in my local community across California, in partnership with others, going forward. And yeah, so hopefully continuing to be a good in good service to folks. So that's what I'm hoping for in the future professionally.
Wonderful. Now, what is your advice for students who are looking forward to make a change or to be an element of change in their communities?
Well, first I would say recognize all that you know and all the expertise you bring by being a member of your community. And so I would say start with what you know and recognizing your power and all that you bring. From there, I would say find others who know the same or who know the same things in different ways, and together engage with each other. Well, what do we all see? What are the strengths as well as the challenges, right? And I think that's really important. Sometimes we get so fixated on needs or deficits, right? But there are so many strengths in every single community, right? And the fact that, if this is a student who is interested in making a change in their local community, they are a strength because they have that interest and they have that desire and they bring all that with them. So I would say start from what you know, find others who know similar things and different things, and then grow together, building on those strengths to move towards the transformation that you want to see, partnering with others.
Thank you. Thank you, Dr. Rachel Berkowitz, for your commitment to public health and for sharing with us today.
It's been an honor. Thank you for having me.